The nervous system is comprised of the central nervous system and the peripheral nervous system. This video is an introduction to the central nervous system. I will briefly discuss important concepts such as anatomy, function, and pathology, which are relevant to cases you may come across in underwriting and claims assessment. The peripheral nervous system will similarly be covered in a subsequent video. The central nervous system consists of the brain and the spinal cord. It is responsible for processing information about the environment, maintaining the body's own internal functions, and allowing the body to respond accordingly to stimuli or input from either the body or the environment. Processing of information is made possible through a network of chemicals and nerves inside of the brain, spinal cord, and the rest of the body. The peripheral nervous system connects the body to the central nervous system. Neurons are nerve cells. Neurons are the building blocks of the central nervous system and an essential component of the nervous system. The brain contains over 90% of the body's neurons. Each neuron has a cell body, dendrites, and an axon and a synapse. The function of the nerve system is dependent on the transmission of electrochemical impulses. The cell body receives the impulse via the dendrites. The impulse is then conducted down an axon to the next neuron. The gap between the neurons is called a synapse. The axon acts like an insulated wire and is covered by a myelin sheath, which allows for quick transmission of the electrochemical impulse. When the impulse reaches the end of the axon, it is transmitted through a synapse to another neuron or muscle cell. Neurons receive electrochemical impulses and input from other neurons through synapses via chemical substances called neurotransmitters on their dendrites. Neurons send information out through the axon to other neurons or organs. The brain is found within the skull. It has over tens of billions of neurons. The brain has three main structural divisions: the cerebrum, cerebellum, and brainstem. The brainstem is situated in the base of the brain and skull and comprises of the medulla, pons, and midbrain. The cerebrum is the largest component of the brain and is divided into left and right hemispheres. These hemispheres are connected by a collection of white matter fibers known as the corpus callosum. The two hemispheres are further divided into lobes or regions: the frontal, parietal, temporal, and occipital. Other important regions are the thalamus and hypothalamus. These various areas are responsible for complex functions of the brain such as memory, mood, movement, speech, and comprehension. The brain is also responsible for regulation of other functions such as your breathing, heartbeat, and body temperature control. The cerebral cortex makes up the highest level of the nervous system functioning. The anterior or front region of the brain deals with executive function, and the posterior or back part of your brain deals with processing and perceiving the environment. Central nervous system, both brain and spinal cord, is protected by three meningeal layers. The meninges are membranous coverings of the brain and spinal cord, namely the dura mater, arachnoid mater, and pia mater. The brain and spinal cord is surrounded by a clear fluid known as cerebrospinal fluid. It is often referred to as CSF. It is produced and reabsorbed in the central nervous system. Cerebrospinal fluid acts as a cushion to the brain within the skull. CSF can be used to diagnose various conditions, and collection of the cerebrospinal fluid is usually through a lumbar puncture. The brain has a rich blood supply. The blood supply originates from the internal carotid arteries and the basilar artery. You may have heard of the Circle of Willis. This is a network of arteries which supply blood to the brain by connecting the anterior, posterior cerebral arteries to the anterior and posterior communicating arteries. The spinal cord is situated in the vertebral canal of the vertebral column. It starts within the base of the brain and ends in the lumbar region of the spine or vertebra. The spinal cord contains nerve fibers. The organization of the nervous system allows doctors to diagnose impairments, diseases, and disorders. Should a patient present to a doctor, it is essential for the doctor to examine and identify the region of the brain that is most likely responsible for the impaired function. There are so many special investigations that can be used to investigate neurological or nervous system dysfunction. Blood tests, lumbar punctures, scans of the brain and spine, such as CT scans and MRIs, are common investigations you may have come across already. The aim is to identify the region involved and to correlate the information to make the correct diagnosis and treat the patient. As mentioned earlier, the brain has two hemispheres. Certain regions within the hemisphere control opposite sides of the body due to the structure of the brain. This is important to remember for neurological claims. So, what can go wrong? Pathology to the central nervous system refers to abnormalities that occur within the system. Pathologies may be grouped into the following causes: vascular, infective, traumatic, degenerative, or tumors, which can be benign or malignant. A stroke is an example of a vascular condition. It usually occurs when there is an interruption of blood supply to a region of the brain. The symptoms and dysfunction are related to the area of the blood supply that is interrupted. For example, if the affected region is responsible for speech, the patient will present with slurred speech. The effects of a stroke can be temporary or permanent, dependent on the severity of the stroke, time to diagnosis, and treatment received. Clinical signs and symptoms, risk factors, and evidence of stroke on imaging is required for most insurance claims. Risk factors include hypertension, diabetes, smoking, and excessive alcohol use. Multiple sclerosis is an example of myelin sheath damage or disruption around the axon of a neuron, which results in abnormal transmission of information between nerve cells. It is an immune-mediated disease. Due to the nature of the anatomical dysfunction, signs and symptoms can be related to sensory loss or motor dysfunction. Symptoms can vary depending on the nerve affected. Symptoms include weakness of limbs, tingling, pain, visual loss, or electric-like shocks that occur with some movements. Multiple sclerosis can be relapsing, remitting, progressive, or progressive relapsing, which means that symptoms can occur occasionally or progress to a chronic debilitating condition. Meningitis is an inflammation of the meninges and usually associated with an infective cause such as virus or bacteria, but meningitis may be aseptic as well. The classic symptoms of meningitis are headache, fever, and neck stiffness. If the cause of the inflammation is treated, the effects of meningitis can be minimal. However, in severe cases, it can lead to complications such as paralysis, hearing or visual loss, or hydrocephalus. Other conditions related to the central nervous system are brain tumors, aneurysms, psychiatric conditions, epilepsy, dementias, Alzheimer's, and accidents causing traumatic brain or spinal injuries. To assess underwriting cases and claims, you require neurological examinations performed by a neurologist, imaging, blood tests, and other special investigations to assess the risk at underwriting or the validity of the claim in terms of the definition in the critical illness or disability benefit.